Hi everyone, welcome back to my YouTube channel. Today we are going to talk about parietal bone. And here at the side you can see the diagrammatic representation of skull showing highlighted part that is parietal bone, and this diagram is for the reference. So let's start topic with introduction. Parietal bone is one of the major bone of skull. It forms the superior and lateral aspect of cranium and contributes significantly to structures that encase and protect the brain. There are two main parietal bones, left and right, which together make up a large portion of cranial vault. Location and articulations of parietal bone. Parietal bone is located on the sides and roof of skull, as you can see here in the diagram. Each parietal bone articulates with several other cranial bones, including it articulates with frontal bone anteriorly, it articulates with the occipital bone posteriorly, it articulates with the temporal bone inferiorly and sphenoid bone anterior-inferiorly. The two parietal bones also articulate with each other at the sagittal suture in the midline. Now let's talk about structural features of parietal bone. Each parietal bone has distinct anatomical landmark. They have external surface that we will talk about first. In external surface in parietal bone, it has parietal eminence, that is slight elevation near the center marking the ossification center. Second, on external surface there is superior and inferior temporal lines that are curved ridges for muscle attachment. Third, we have is parietal foramen that is occasionally present near the sagittal suture that allow passage of emissary veins. Now let's talk about internal surface of parietal bone. In internal surface, there are grooves for blood vessels that are indentations left by middle meningeal artery. Second, it has sagittal sulcus that forms part of groove for the superior sagittal sinus. Third, it has impression of our cerebral gyri that are caused by convolution of underlying brain tissues. Development of parietal bone. Parietal bone develop through intramembranous ossification beginning in the area of the parietal eminence. Ossification starts during fetal life and completes by early childhood. Initially, they are separated by sutures, the bones that eventually fuse to form a solid cranial vault. Functions of parietal bone. Parietal bone serves multiple vital roles. First function is protection, as they shield the parietal lobes of brain. Second function is structural support, as they maintain the shape and integrity of skull. Third function is attachment point, as they provide surface area for muscle attachment. Fourth function is brain insulation, as they act as a barrier against mechanical damage. Clinical significance of parietal bone. First is parietal bone fracture that may result from trauma and pose risk to underlying brain tissue. Second significance is craniotomy procedure that often involve the parietal bones due to their access to cerebral cortex. Third significance is parietal foramina anomalies that can be associated with vascular and neural abnormalities. So this was all about parietal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.